ahead and start. I'm excited about tonight
Me too.
because it's a very important subject that nobody touches. Ahead and
Don't even
start.
think about it, and many people are suffering. Well, welcome. Welcome to Medical Mondays with Dr. O. And I am hoping that I can get my equipments right here. Whew. I hope you all have had a great day, great Monday so far. I'm Dr. Toyin Okpesomi. I'm a family practitioner. I treat HIV and drug addictions in Maryland and host of Medical Mondays with Dr. O. Tonight, we have a topic that I don't think any of us have addressed, but some might have experienced this. A lot of people actually experienced this, and I said some on our platform maybe has experienced this, and it's neighborhood strife. When you have a neighbor from hell and how it impacts health. Hopefully, we'll talk about how to, deal with situations like that. But we happen to have tonight one of our own Medical Mondays family member, Dr. Kehinde Elisha, who has been through. So, without much ado, I'm yielding the floor to you to take it over and educate us, please, on neighborhood strife.
All right. Thank you so much for having me. And my name is Dr. Kehinde Elisha, just like she said. I've been on this platform before. I'm so glad and blessed to be here again. Since the last time I was here, I think I haven't taken up a role yet with the county. Currently, I'm at large representative for Loudoun County Department of Mental Health, Substance Abuse and Developmental Services. That's MHSADS. I'm also the founder of Confident Prescriber LLC and NP Certification Academy, where we certify students to pass their board exam in mental health examination, family nurse practitioner, excuse me, adult gerontology, NCLEX exam review, and all that. So, but my passion really holds strongly when it comes to mental health. So, mental health is everything to me. So, people around me actually joke and say, okay, Mrs. Diagnosis, that's what my kids even call me now. I'm so quick to come up with some differentials, especially when somebody really gets on my nerves so bad, or I cannot explain what they're doing and why they are doing what they're doing. So I tend to observe like that. So um, that's not to say you should be running away from me. Try promise I won't diagnose and tell you what it is. I'll keep it within me. I've learned to do that. All right. So now we're gonna jump right into this topic. So guys, excuse my word for saying guys, so, friends and family, this is the reason why I'm here today, just to educate us a little bit more about mental health and integrate it into how it impacts us as a community, as people. And, the epidemic of mental health is really a lot out there, and it's so almost, impossible to curb the spread of mental health. People get depressed over certain situations, as simple as somebody doing something wrong to you, somebody looking down on you, somebody stereotyping you, or you suspect that somebody is being racist towards you, or somebody is having some kind of prejudice towards you. These are things that generally affect our mental health. And then, until you really experience such things, you don't think about it. You think, well, it has nothing to do with me, that's their problem. And at this point, I'm beginning to feel and think, what, it's not about their problem. I think we should start seeing it as everybody's problem. Because we have kids growing, people are growing from generation to generation. So even if it doesn't affect you, it's going to affect the generation to come. So, and that is why I'm so passionate about this topic, because with my experience, I almost turn psychotic too. When people are shouting at you, and you get to a point, you start shouting back. You're looking psychotic too. And I'm like, no, this has to stop. Like, I can't do this. But I'm not going to go into this situation, but I can tell you right now that neighborhood strife is real. And I'm telling you right now that it is not about white or black. It's not it. It is not about white or black. Oh, that white doesn't like me. That black doesn't like me. That African American doesn't like me. Sadly to say, it is among African to Africans, in African to Indians, Indian to Africans. Shockingly, that's what it is about. It is not about white or Black. So my opening statement today, we need to give them a break when it comes to being racist, because we have our own ground problem to resolve first without having to place so much emphasis on them. Maybe the change should start with us. What we do to each other as foreign Americans is worse than what Americans are doing to foreigners. Even if foreigners would do it, even if Americans would do it, there is a way to do it. You know what I mean? It is not to the level of hate that we do it to one another. But that's all I'm going to say. I'm not going to say more than that. So what did I pick up from my personal experience? I picked up that, you know what? Why don't you make excuse for this person just like you do for other people when they offend you? So I started to look and I started to look and I started to watch the pattern of the behavior, a little bit of the history I know about this person's family, right? And I started to put it together and I started to suspect some kind of psychopathology. And I was like, you know what? When people have a stroke, we feel bad for them. When people have a heart attack, we feel bad for them. When people have mental illness, we tend to stereotype them. We think it's an excuse. All right? So when people have a heart attack, we feel bad for them. But when people have a mental illness, we don't think that they have a brain attack too and feel bad for them. And that kind of like drove it all home for me. I say, you know what? I'm not fighting again. You know what I mean? Like, you can't just fix chemical or structural imbalance. You can't fix it by fighting. You can't fix it by trying to prove a point. But there are other ways to fix it. You fix it by educating the world. You fix it by bringing mental health into this. And that is not to stereotype people with mental illness, that it's okay for them to misbehave. No. But we're saying there are some behaviors that they're going to exhibit that they truly can't help. And we must come to terms with that and be educated about it and be well informed about it. So today, I'm going to make my topic all about autism. I'm going to integrate autism. I'm going to integrate some differential diagnosis with autism. I'm also going to, for one more time, emphasize that racism is not about color. It's not about color alone. It's also happening in other cultures. And this topic is not going to be about racism. The emphasis is going to be the fact that racism can manifest within other psychopathologies and it's going to look like racism. And I'm going to prove that point to you, why it's going to look like it, even though it's not it. Does it make sense? What would be nice is for those people to become more aware of themselves or to lay their hands on this lecture and become more aware of themselves and then tone down whatever is making them look like it or act like that. And it's not just about racism, it's about just the way we treat one another. Some people truly cannot help it because of the kind of pathology that they already have. So we're now going to get down to it. And we're going to quickly talk, first of all, about the main thing I want to talk about, the main area I want to focus on is the very first thing I'm going to quickly lay out. So we have a book. It's called the DSM-5TR. I am not here tonight to tell you to diagnose your neighbor, to tell you to diagnose yourself. I'm not here to say that people around me have autism, but I'm just saying also, I would love to base it on that because there is a lot of pathology that fits into it. And many adults grow up throughout their lives without having the opportunity to get diagnosed with this condition. So, what is autism? How do we diagnose it? What are the criteria that must be met according to the DSM-5TR, which is almost like the Bible that we have in psychiatry? Bible in the sense that we go to it for every diagnosis. Some people like me are fortunate to memorize it and just know it, period, because I teach it every time. But at least knowing where to look is paramount for providers so that we can nail things down when we see it. So what are the main criteria that is laid out in this book? So with autism, what do we see? We may see persistent deficit in social communication and social interaction across multiple contexts as manifested by what? deficit in social and emotional reciprocity, difficulty with back and forth conversations. They just can't do it. They don't have the ability. Does it make sense? They lack the emotion necessary to actually function properly in social settings. So a lot of times they actually recognize it and they want to pull back from social settings just to cover that part up. But if they have to be in a social setting, there is some level of awkwardness, excuse my language, that is seen. But they are people too. That is just the way they function. That doesn't mean they are bad. That doesn't mean they're awkward, but that is kind of the cluster that we have them under, which is cluster, very, very close to cluster A, personality type, very much. The second point that we're gonna see in the DSM-5 is deficits in nonverbal communicative behavior. So if your neighbor is not talking to you, perhaps they're going through this. Maybe they can't. Or you say hello to your neighbor, they just can't respond. Maybe they don't have the ability to do so. So my point again, we have to start making excuses for people. Does it make sense? Now, deficit in developing, maintaining, understanding relationships. So they have difficulty adjusting behavior to suit various settings. So there is no way they just don't understand those basic things. They don't understand jokes. They don't know how to be flexible, if I may say. What about the second part? Talks about restrictive, repetitive patterns of behavior, interest, or activities that's manifested by what? At least two of the following. They may have some repetitive motor movements like, hand flapping, lining up toys, lining up things, or echolalia. Echolalia means they repeat what you say. You say, sit down there. They say, sit down there. Come here, come here. We have different spectrums, but these tend to manifest in some. Insistence on sameness, inflexible adherence to routines or ritualized patterns of verbal or non-verbal behaviors, extreme distress at small changes. You make a small change, they just can't handle it. And the reaction that comes with you making that change is so blown up that you are like, what did I just do? What just happened? But to them, those small changes seem so magnificent, they just cannot handle it. What about highly restricted, fixated interests that are abnormal in intensity or focus? Strong attachment to unusual object, excessively circumscribed or perseverative interest. Hyper or hyperactivity to sensory input or unusual interest in sensory aspect of the environment, apparent, indifference to pain, temperature. The weather is hot is hot, like nothing really shakes them. Adverse response to sounds or textures. Now, when it comes to people being autistic, I'm focused on adult autism right now. When you talk around them or when they're in a large crowd, let me say New York City, they hear so much noise, they cannot isolate the noise, and then it becomes something that bothers them. Now, symptoms must be present in early developmental period, but a lot of people in so many cultures, this is not picked up. And even if it was picked up, listen, the same kids that were diagnosed as a kid, they also grew up to be adult. And we have a lot of successful people that are actually autistic. Bill Gates, questionably, is one of them. Definitely Elon Musk, that is publicly said. And those are the two that I can really think of. But a lot of people are successful. So it is not a break. It's not a make or break. Does it make sense? Life is still what you can make out of yourself. So now, after talking about this little criteria, I want to also emphasize that when people with this condition, when they go to the doctor to seek care or to a nurse practitioner, like psych mental health nurse practitioner or family, psych MP or so somebody, they will first of all give them some scales to see where they really are. So for adults, what do we tend to use as a scale to see that is this person really autistic or not? It is autism spectrum quotient. Below this video, we're going to link some of the scales, and I'm going to work with Dr. O on that so that people can grab the scales and do a self-assessment. And then if you or your family member feel like you're autistic as an adult, then you may want to go to special centers to get tested. I can say right now, if you're autistic and you don't know it and you've been living through life with autism, I promise you, your life is going to be way better once you find out. Because now you're going to know why. You're going to know the answer to the whys. Let me just leave it that way. You're going to know the answer to the whys. Why are they avoiding me? Why am I fighting with everybody? Why am I fighting with my neighbor? Why am I hating that person? Why do I have to be by myself? Why can't I look at people in the eye? that will be resolved, especially within African community. Okay, so I'm advocating for this. I've done a lot of work after this, issue with that I had. Like I said, definitely with my neighbor, you know what I'm saying? I actually had to dig deeper into this and I came to that conclusion. And there were other factors I also put into that too. But anyway, what are the scales that we're going to use and link below this video? It's called Autism Spectral Quotient. It's a scale. It has it's a self-reported questionnaire developed by Simon Baron Cohen. It's 50 items. It's going to assess your social skills, your attention switching, attention to detail, communication, and imagination. And it's widely used. That's very, very popular. Another scale is going to be Read-Vo Autism Asperger's Diagnostic Scale revised. So listen, we don't have Asperger's anymore. Asperger is now under autism. In fact, Elon Musk, who was actually diagnosed with Asperger's syndrome, but definitely under autism now, is an 80-item self-report or clinician-administered questionnaire designed specifically for identifying ASD in adults, including those who are not diagnosed as children. See what I'm saying now? A lot of people were missed, guys. I can't even go there today, but I'm telling you right now, if somehow, okay, you're getting the same complaints from more than two people that don't even know you or that never grew up with you, and there is some complaint about your behavior, it's time to explore it. I'm just saying. It doesn't have to be autism, it can be something. Listen, we are soaked in mental health. Mental health surrounds everything that we do. So it is what explores, it's exploring this one as well. Read-Vo Autism Asperger Syndrome Diagnosis Scale is revised. That is there. Autism Spectrum Quotient 10-item scale is there. Social Responsiveness Scale adult version is also there. And then Adult Asperger's Assessment. And I'm going to leave the rest and we're going to drop it under this video. At this point, I'll be sharing my slide. And I just felt like I should talk about that. So as I speak, I'm going to make a reference to it. But I really hope that we are all seeing this the way I'm seeing it. I'm going to make a disclaimer again. Anybody here today with autism or that think that they have autism, this is not to say you are racist. This is not to say you are bad. This is not what it's about. This is about creating awareness, you know, to say, you know what, some people are just different. That is the way they think. That is the way their brain function. And to bring awareness also to you so that you can see where things, you know, are going wrong in your relationship or relationships and make necessary adjustment. So beyond black and white, understanding racism from mental health perspective. All right, so what are we going to be covering here? We're going to be talking about racism, culture, and mental health, the hidden layers, when mental health is mistaken for hate. When mental health is mistaken for hate, okay? Beyond black and white, understanding racism from all angles, racism from neighbor to neighbor, what mental health got to do with it. So that's what we're going to be looking at tonight. So what does racism look like in our daily lives? So if it is from neighbor to neighbor, what does it look like? So the first thing that I that I looked up was this one. I'm like, wow, this is interesting. We've been going through this for years. I didn't realize it. Neighbor to neighbor. So refusing to greet or acknowledge neighbors of a different race. You say hello to them, they just won't say hello back again. Maybe it's connected with autism, right? Communication issue, being shy and stuff like that. But hey, that is not an excuse not to get some therapy to adjust that, right? What about making derogatory comment about someone's food, language, dress, or traditions? Okay, that is not pleasant either. These are the things that I've seen on a link that I got it from, that they are signs that, you know, someone is being racist towards you. Using property boundaries as a reason to harass others. This was like, I can't even go there. Calling HOA or local authorities over trivia or fabricated issues involving a neighbor or a different ethnicity. By the time they call in HOA on Monday, Tuesday, Wednesday, just over your stupid things, you know something is not right. That is when you're going to begin to suspect, especially calling the police over trivia things when they are busy dealing with emergencies. That is when you should raise an alarm. And trust me, there are agencies that deals with this. There are civil rights agencies and there are consequences. And mental health is not excused. You know what I'm saying? That is why awareness needs to be created so that people can adjust accordingly if they have any kind of mental health issue. So in the workplace, what does racism look like? Dismissing a colleague's ideas due to their accent or background, denying promotions based on race despite qualifications, forming cliques that exclude certain ethnic groups, microaggressions, jokes, assumptions, or backhanded compliments, excuse me. So let's dive deeper. So we know what it is, okay? We gave some traits of what it could look like. But the thing is, there are some things too that we can help, or there are some people that cannot help some of those behaviors, right? So we're going to start pointing them out now. One of them is paranoid personality disorder. So patients with paranoid personalities, they look just like that. They're going to be checking through the windows. Yeah, are they coming? Are they coming? Is she coming? Is she coming? They cannot help it. And you're gonna know they're looking at you and staring at you and gazing at you. When your neighbor is doing this to you, wouldn't you think they're racist? Does it make sense? So I want to also bring to your knowledge today that people with paranoid personality disorder will act like this. Does it make sense? And that is nothing to shame those with paranoid personality disorder, but it's just to bring awareness that it's not all racism. Does it make sense? Now, so how it may mimic racism? How? They may appear hostile. They will avoid you for sure. They don't trust you to start with because they are scared due to the paranoia, right? What is the clinical explanation? PPD will cause deep-seated distrust of others. That is just what it is. But there are legal implications too, though. They may face civil complaints to those that know nothing about mental health. And if it is not mental health, they may truly be like that. But if they are not like that, it may be mental health. It doesn't make sense. So we have to think of both perspectives before we go down that path that, oh, he doesn't like me, she doesn't like me, and then ruin our own mental state too. It's not worth it. So there are consequences, even if it is mental health related. They may face civil complaints that they are hostile. You know, they may, you know, they may not be able to prove the reason why they're doing what they're doing because that is just the way they are. That is just the way their brain function. They have a disorder that they need to get help for. So how to get help and how it affects other people. So in the neighborhood, accusing a neighbor of spying or sabotage can lead to fear, tension, or even restraining orders. In a school setting, it may lead to isolation or report of discrimination. See what I'm saying now? Like, this is where a lot of discrimination come from, but we don't think about it in terms of mental health. And don't get me wrong, not everybody that acts this way have mental health issues. But what about those that have it? Do we even know them? We can never know them. It's not written on their forehead. So how to get help then? You want to encourage them to visit their primary care provider or a mental health professional for evaluation. That way they have it in their record. And even if any lawsuit or any legal issue comes up, we're going to say, okay, they are not, what we think. They are not being stereotypical. They are not being racist. They just have PPD. All right. Now, the next one is delusional disorder, similar to PPD, right? Of course, what do? They claim that people of certain race or group are harassing them, arming or surveying them, even without evidence. They have no proof. They will just make this accusation out of on a blank paper. That's it. Like nothing, no evidence. So they have this false belief that no one can really, assess or check or dispute because they are so locked in that belief. So, but that's a legal implication too. They may file repeated complaints, defame others, or make threats based on false assumptions. Civil risk of civil or criminal consequences that increases with escalation. So, how are they supposed to get help again? They need to, if it's neighborhood, if they are accusing innocent neighbors because of their race, and they are so scared and they are having delusions about that person, like so fixed on that person, it may lead to legal issues. So they may also need to contact their mental health department or mental health clinic for help or support. What about somebody with schizophrenia? You're going to find the same pattern here. With schizophrenia also, what is the criteria? They're having delusions, they're having hallucinations, loose associations. And when they're having this, they can also misinterpret whatever is, around them. And this is, naturally they're like disconnected from reality. Does it make sense? Uh, you know, they might claim that somebody's trying to hurt them. They might say somebody's watching them, and it's not true. And I actually had a story before that one of my students told me that their neighbor always called police on them, and the police told them that, well, we can't find anything. And every night they call the police on this neighbor that the police is trying to hurt them. Fortunately, there were cameras around the house and they couldn't figure out why this person was doing this. Eventually, they took the patient, they took the neighbor for, I mean, or the neighbor went to for a mental health evaluation and they found that the patient actually is schizophrenia. So imagine if we're not in a place like this, that we have some law in place that at least can actually investigate and come up to a conclusion before taking somebody to jail. Can you see how the innocent neighbor can be grounded for this? So I'm just saying, we have people walking on the street with schizophrenia and they would act. They may see you and even run. And because you don't have the knowledge of mental illness or mental health disorders, you may connect with, oh my goodness, that person is being racist, that person hates me, that person hates my accent. Before we jump into that conclusion, let's just quickly, first of all, know who you are first before you start saying somebody is stereotyping you, because they may be the one that is, they may be sick and there's nothing anybody can do about it. They have to be the one to go seek help. All that also have legal implications. And of course, same thing. Um, Within the neighborhood, what would they look like if they have schizophrenia? Neighbors may feel threatened or confused by loud and accusatory behavior because false accusation, get off my property, get off my this, get off my that, and nobody's even touching your property, right? Now, school, fellow students or teachers may be distressed by speech or behavior. Workplace, racially themed delusions may result in HR intervention, fear, or job loss. And of course, in this situation, the people that can see how they are behaving can decide to call 911, or they may need to go out and seek treatment. But when it comes to schizophrenia, there's a big deal that they may need to be involuntarily admitted. What about substance-induced psychosis? That can also mimic hate and, all those words that we don't like, stereotype, racism, because they are not connected, right? They already have something in their system. So this one is well explanatory. What about bipolar disorder? Well, with bipolar, we have two mood states, right? Our mood can either be up here or our mood can be down here in the dump. And that shift in mood can cause things. They may blot out grandiose or racially offensive remarks. When they get into the manic phase, they will say anything. Anything that comes from their mouth, they will say it out. And whether it is true or not, but to them, they want to get back to you at that moment, right? That is the way manic people with bipolar want them to do, right? And then they tend to calm down, but usually calming down is not something that is automatic unless they seek help as well. So clinical explanation, during mania, judgment is impaired to start with. The person may talk too much. They may say things that are not appropriate, not appropriate at all. They may act superior. They can even include racist sounding language without racist beliefs. See that? They may yell out racist words without racist belief. And this happen a lot. And the person that is fighting you at work, in the society or whatever, you don't know what they have. And then you go around, I'm like, oh my God, I can't believe this. I can't believe this person just, call me that name and call me that name. I used to work in Paki, one of the hospital in DC, and a patient came straight from the OR. And I know it was during pandemic when everybody's emotion is up and down to start with, everybody's trying not to die, right? And the patient came and be like, as soon as this patient opened his eyes, I don't want a black nurse. I don't want a black. I'm like, what? I took it really personally. I'm telling you right now, many of us do too. I took it personally. I actually broke down crying on the spot. We have to listen to what the patient wants, right? Whether they are right or not, whether they have bipolar or not, whether they are psychotic or not. So they moved me to another unit because of that one patient. Apart from the embarrassment within the entire PACU unit. But I'm saying now, if I had this knowledge at the time, does it make sense? I will quickly come out of it. I wouldn't break down like I did because I broke down so much I couldn't go back to work for a week. So can you imagine people in the society how they feel about this? So now that is what is gonna now do what promote keep adding more and more to mental illness. We're gonna keep having people with, you know, issues because they believe in whatever they are called. So what I always advise young people is just know who you are before you get out to the society, because we have neurotypical people and we have the neurodivergent people, and we must be able to adapt to any kind of critique, any kind of a stereotype, any kind of judgment. You have to have the thick skin to take it because you don't know who you're going to run into. And you're not going to go diagnosing everybody. And don't get me wrong, whatever the diagnosis is, it still will not feel good on you. So believing in yourself and understanding your own self and developing that thick skin is important to survive in society anyways. But I'm trying to educate here today that there are other reasons why they do what they do. It is beyond black and white. It is beyond black and white. So we need to get beyond that a little bit. Does it make sense? We need to get and look beyond that. And that's why I'm educating us today. So how do you get help then? The same way to get help. Just go ahead and seek support. We have, you know, ACT, we have NAMI, we have all these community support groups that you can go to, educate yourself about your mental health so that you don't continue to go down that path, so that you don't continue to offend other people if you are that person. So autism spectrum disorder, this is not my favorite one that I want to really bank on, because with this one, there are many differential diagnoses that tend to kind of fall underneath it. And that is what I tell providers. By the time you're coming up with 3 or 4 diagnoses for one person, and among those 4 diagnoses, you have like 2 or 3 personality disorders, you want to go ahead and check out autism. You might have missed autism. Go and work them up for autism. That's kind of what I see, because a lot of pathologists actually seem to mimic autism here. So what is autism? I spoke about it earlier. We're now going to talk about it a little bit here. How does it look like racism? How may it mimic? How can it mimic racism? You know, they may say socially inappropriate things or racially insensitive things without understanding the impact. That kind of falls under their communication issue, right? That they have the issue naturally, right? So they are saying it not really to hurt you. They are saying it because their brain is fractured. That's the way the brain is. That's the way the brain works. That's all they know, right? And now they say to you that you now broke down, or they say to you, you want to say it back. And then the cycle continues. So look, clinical application explanation. Individuals with ASD, they often have challenges with social cues. They can't just connect. When you blink, they don't know what it means. When you smile, they may think you're laughing at them. It's complicated. You know, pragmatic language and interpreting emotional tone, they don't know how to do that. Their intent is not malicious, but they may not realize that a comment is offensive. That's one thing, they don't get it. But you, that you are taking it, you can only take so much of it, right? Legal implication is also there, you know. In schools or workplaces, these remarks can still lead to disciplinary action or complaints. When people are complaining too much, yeah, they have to do something about it until maybe they work them up and then they realize that, okay, we need to, you know, soften up a little bit. They're actually autistic. So being aware of ourselves is extremely important to even survive in society. So autism is what? Is a neurodevelopmental condition that affects communication, social skills, behavior. People with high functioning autism or Asperger's syndrome often struggle to interpret social norms or tone or emotional cues, leading to blunt or inappropriate comments. I was personally actually taken on for Elon Musk. Not that he's my favorite guy or anything, but truly, I saw myself backing him up. The internet was tearing him apart when something happened recently with him and Trump. And I'm like, I promise you, this guy he doesn't mean it. He doesn't mean it. And somebody told me, get out of here. I said, yes, I know what I'm saying. Come, let me show you what autism is. Then I had to actually educate them. I said, it doesn't mean anything. He's saying it's just blood. That's just the way his brain is designed. That is the way he sees things. Very, very, you know, they will look like they are disrespectful or they are arrogant because they don't they cannot maintain that eye contact. They make blunt statements. That's their behavior. That's the way the brain is designed. He didn't design his brain. And then we think they're rude. Obsession with topics like race, politics, or flags, and they're so fixated on it. You know, poor response to emotional cues. They lack empathy. Listen, they lack empathy. You can say everything you want to say about, okay, the kids in Africa, they can't get the benefit anymore. These people can't get that benefit. It's not connected. They're not connecting with it. Okay, that's just the way it is. All right. So that's self-awareness, even among, you know, it would have been nice to have some social training to help with that, but I don't know. I can't really go into that. But I'm just saying that doesn't excuse a lot of the behaviors, but truly, that is the original person. That is just who they are. They are so blunt. They say it the way it is. They don't know how to filter it. They don't connect with emotions. You may be dying right beside them. They can't see it. So you have to open and say, hey, I'm dying. Can you help me out here? Like that kind of a thing. You know, so now how to get help and how it affects others. Neighbors may feel uncomfortable and offended by blunt statements. Of course, I felt offended too. And then school, all the students or staff may misunderstand and feel hurt. I actually remember being somebody telling me blunt stuff using a language that I don't even understand. I make sure I repeat that blunt word back to them in that language too. But I'm saying that is where we don't want it to get to. You know what I'm saying? If we have this knowledge, we don't need to let it get there. Just come up with 3 or 4 differential diagnoses and keep it moving and find a way to shake it off. It doesn't mean it's going to land right on your body, but it's just what it is. What about people with frontotemporal dementia in nursing homes? There was one video circulating around about this poor old woman, and she happened to be Caucasian, and she was calling these racial words, racial slurs. I was saying when I saw the video, and people were making all kind of comments, it tells me how unaware we are as a society about mental health. This lady has dementia. That is the way they are. They curse people out. They will throw stuff at you. They will fight. They don't, that is just their personality. That's not their personality. They have frontotemporal dementia. The frontal lobe is messed up. So they're going to have personality changes. So that is not them. So your knowledge of that will help you understand. But guess what? The nursing assistant was actually beating this woman up. That's kind of what I'm trying to say. That is a natural human response, but that is also lack of knowledge. You know what I'm saying? If we have that knowledge, she's going to chill, find a way to calm this woman down. So that is frontotemporal dementia. That's how it showed. That's how it reflects. I don't know if anybody saw that video. It went around for a long time. So they blot things out too, racial slurs, inappropriate jokes. They say things, but they don't mean it. But they have that damage to the frontal lobe already. They really, really cannot help it. And of course, they can also get help um, if they choose to. Obsessive compulsive disorder can also mimic racism, can also mimic stereotype, they also say the same thing. Intrusive thought with racist content, which they find distressing, and fear define them. Uh, these thoughts are ego dystonic. They go against the person's values. You know what I mean? They don't like it, they dislike it. A person with OCD may obsess over whether they are secretly racist or so whatever, it's just an obsession. They look obsessed, they're obsessed. It doesn't have to be with cleaning with anything. With that neighbor, with that co-worker, they are just so obsessed. And they just never get tired. That's just what they're fixated on. Again, they need to seek help to come out of that. What about narcissistic personality disorder? Okay, narcissism and autism are two terrible things to mix. They can't just go together in the same bowl. They will blow up. I mean, a month of mixing it up and still staying together in a glass for a month, they're still doing good. They are two opposite things, but and some things also overlap. But look, narcissistic, they are ego dystonic, right? Sorry, they are egoistic, right? So that means that you have to kind of worship them. Well, people with autism, they don't know how to worship people. And they are blunt and they will say anything too. And they don't have secrets. You think they have leaked any secret? No, they have not. They're just starting. That is just the way they are. They will say whatever comes out of their mouth unless they have someone restraining them not to speak. So now narcissistic personalities that can also mimic racism, and they may not be racist. Honestly, I'm saying that from with everything inside of me. They may not be racist. They may make demeaning or superior comments, even about women. They may not be trying to put our women down. That is just the way their brain is designed. I believe in mental health. I believe those research were not done for nothing, and they are real. Narcissistic personality, NPD involves what? Lack of empathy. They really don't care, man. And that is why you're going to see some people with narcissists making fun of the handicapped people. They will say it the way it is. You know what I mean? Making jokes about women and women's body. It's not like they don't really care. They just can't help it. Doesn't make sense. And they love to be admired. Comments meant to elevate oneself may come off as racist or elitist, and even race if race wasn't the direct target. So race may not be the target. That's just the way they are. You know what I'm saying? That's just the way they speak. But it has legal implications too, though. If somebody continue to feel this way or continue to get this blow from them, they will feel bullied, they will feel accused, and they have to go to HR to complain. So that's kind of how they lose their job. They never really find a place in life unless they own their own business. I must say that. And it's not like it's easy to work with them too as business owners, just to let you know. The way they are, all these comments, they're going to make it towards you. They're going to treat you just like this as well, even if you work under them. They can't help it. All right. And again, there's help. What are we going to do? A lot of therapy that I get is psychodynamic. We're going to dive into their past to see what actually led them here. How can we better support them? They're gonna do like maybe interpersonal skills training because there is a way to deal with people. We're going to show them that way. And then we have antisocial PD, similar to the ones that we've been talking about. I'm not going to go ahead and go to the table here and come with a nice little summary of everything that we've been talking about, and probably just just cap it up. So we talk about PPD. They are suspicious. They are also towards people of other races or cultures. But let's know that some people can also be this way. But these people, if they have paranoid, they cannot help this behavior. Now, but then they can get help. If they know they are like this, then they can get help so that they can better integrate and support other culture. Delusional disorder, schizophrenia, substance induced. This is just the summary of what we talk about. And I don't need to talk about this explanation again. And then we'll talk about autism, frontotemporal dementia. We'll talk about OCD, narcissism, antisocial PD, and that is it. So, general tips for everybody. We must be self-aware. Reflect regularly on whether your thoughts or actions are being influenced by symptoms, right? We must be self-aware. Is it due to pathology or are you just like that? So, because we can't say everything is pathology too, let's be honest here. So, it could be, you know, it could be just you might have been influenced by the society too, by the community. So it could be multifactorial. Maybe you're behaving that way because that's the way it is. In Africa, Igbo don't rent houses to Yoruba, Yoruba don't rent houses to Igbo. Maybe that's what they've seen and they grew up to be that way too. So maybe it's not even psychopathology. So, what about apologize and educate? If you've said something offensive during an episode, maybe you blow out or you had an argument with somebody, take responsibility and explain your condition to somebody. It's not a secret anymore. Mental health can affect anybody. I think we actually, at this point, I think we all have mental health issues. We just have to know exactly what it is so that we can better cope with it. I think it's the degree that is different. That is all I can say. Now, what about support networks? Build connections with people who are both culturally affirming and supportive of mental health. Professional help. You better see a licensed mental health provider. We have so many nurse practitioners that are there providing nice little support. We have medical doctors that are doing their job. We have a lot of providers out there. All you have to do is call up and call them up and seek help. Emotional regulation and coping with racism and stigma. And I'm going to also make a point tonight. I have many mental health providers that have clinics. And if you really, really need support, please let me know. I'll be more than willing to refer you to any of the 50 states in America. All right. Now, most importantly, mental illness may explain behavior, but does not excuse harm. Getting help early can prevent damaged relationships, legal issues, and long-term stigma for both the individual and the community. And that is the end. I really hope that you learned something today. I hope you've been exposed to psychopathology that may mimic, prejudice or stereotype or racism, but they are not necessarily so all the time. I hope you've learned that we cannot stigmatize mental health as being the reason for racism. That is not the purpose of this topic. I want to make that clear. But I'm just saying that it's something that is worth exploring. Dr. Kehinde Elisha speaking here again. Thank you so much for listening. Do we have any questions at this time? Thank you.
Wow. Thank you so much for digging deep the way you just did. So if you put the slides down, it would help me to be able to identify people raising their hands. You can raise your hands to ask questions, or you can put them in the chat box. Also, I want to put out this disclaimer that we are not on this platform establishing physician-patient relationship. As you all know, Medical Mondays family members, you know that. But we are sharing information that is important to us in our community and for us personally. So I was going to ask something, but I'm going to hold my breath while I call on Dr. O in California, Dr. Ronke Ogunleye. Kindly unmute. And welcome. Oh, you're still muted. You're muted.
Hello.
Hello, welcome.
Hey.
Thank you for that wonderful presentation.
You're welcome.
For a while there, I thought you were talking about our supreme leader when you were talking about people with narcissistic personality disorder. Because, our supreme leader exhibits a lot of that. At the risk of sounding unempathetic, I will think racism itself is a mental disorder. And I don't mean it in the clinical sense, in the scientific clinical sense. I mean it just the way I said it. Racism is a mental disorder. For anyone to, look at another person's color and decide that, that person is not worth being called a human being, that the group of people who think like that need their head examined. As regards autism, I have come in contact with a lot of students with autism in my former life as an educator. But one thing that I found is that I've found really important, and that I also read somewhere, is that sometimes autism is not just physical. I heard that it could be spiritual, that a lot of kids with autism have gifts that is preventing them from being like you and I, being like everyone else. And that if we truly nurture them, the gifts will come out. What's your take on that?
I totally agree. Well, not agree to everything though, but I agree the fact that they are talented, and I really agree that they have a lot of eye intellect. That's just the way the brain is. They see what normal humans don't see. They do what normal humans won't even think about. Average human won't even think about. But the spirituality, I cannot speak to that. It takes me a lot to think spiritual. Does it make sense? If I hear a news that somebody died yesterday, the first thing I'll be like, oh, they died. How did they die? They say they died in their sleep. I'll be like, oh, it may be a heart attack. That's the way I think. I wouldn't think, oh, it may be from the grandma. It may be the grandma in Africa that cast some voodoo. No, I don't do that. I don't think that way too much. I always have a scientific explanation for things, and that is just me. However, I wouldn't rule that out, that maybe it has a spiritual component, because I really do respect people that believe that. But for the intellect wise, yes, because of the way their brain is structured, they are extremely intelligent, extremely intelligent. Absolutely, yes.
Okay, maybe let me rephrase that. When I say spiritual, what I meant was they have certain gifts that the supreme being, not supreme leader this time, supreme being, God Almighty, gave them. And some of them, it is that gift that's preventing them from being verbal and preventing them from communicating freely. I guess it's what they get in return for the gift, I guess. You know how some people, um, when they're high functioning, not autism, but type A personality, they could also be the most disorganized people ever, even though they're type A, but they could be disorganized in certain areas of their life. So I guess it's a give and take sort of thing. I don't know.
Yeah. So yeah, thank you so much for saying that, for making that clear again, and I really appreciate that. Yeah, so God give them this tool, but I can tell you right now that the reason why they can't speak, or they can't communicate well, or they have issues that they have, is explained based on neurology. I have a neuro explanation for that. I wouldn't say, I wouldn't, and that's evidence based. I wouldn't say it's because of their talent now, because of the gifts that they have now, they are not able to do what they are supposed to do because God gave them that talent. Somehow they are hindered because of spiritual situation. No, I think it's because of the neural, uh, you know, they have a lot of neuro issues that led to that, and I can explain that now too, but I know it's not the focus. But I would say there is a scientific proof. We don't still know the reason for autism, but we know that there are structural abnormalities, and we also know that there have been a hypothesis also that they think is something that happens in the utero that led to autism. And Dr. O also shed some light yesterday also that there's some other issues that somebody is like researching and finding out right now that led to autism, which is very, very interesting. But I don't want to quote her because she's right here as well. Those things that we hold on to, they are based on evidence. But the spiritual aspect, I really don't have any say on that unless somebody can shed more light on that.
Thank you.
Thank you for your question. Dr. O, do you have
Thank you
anything to
so
say
much.
on that question, please?
Thank you. Thank you very much. Madam CEO, Madam VP, kindly unmute. That's our mama at NAPAC.
Yeah,
Kindly.
sorry, hold on, Dr. O. Do you want to say something? Do you want to add more light to what she asked, or you good with the scientific evidence only?
I'm good with the scientific evidence. I think I may know where she's coming from. I
Okay.
believe that what we have, any gifts we have, is God-given.
Mhm.
And people with autism do have specific skills that are usually unique to that person. Sometimes it's mathematical. I mean, they'll do, they may not be able to thrive in most areas, but it could be math that that person knows and they'll be off the chart. So that's a gift. And I think that may be where she's coming from, but I do believe really in the scientific aspect. We still have a lot to research and to learn about autism. Yeah,
Okay. Thank you.
thank you. The floor is yours, ma'am. Madam Lara, where is she?
Yes, I'm right here, Dr. O. Good
Access.
afternoon.
Welcome, ma'am.
Commissioner in purple.
Welcome, ma'am.
Hey, Dr. Elise, I couldn't see your name. I apologize because I've been driving.
Elisha.
Elisha,
Yes.
Dr. Elisha, fantastic presentation. I'm very excited because I transact in the demographics that you're talking about. So if I was even to reframe your presentation, I would call it "Give me a break," because what you have pretty much explained to us is
I'm gonna close it.
people need
Leave it at
to.
first.
That's not me. I don't know who that is.
Mhm.
That we need to understand. We need to be more aware in order to foster some level of empathy towards these people. Not everybody who talks negative is racist. Not everybody who acts this certain way is crazy. Those kind of things. And, it has to do with our own upbringing. It's a certain perception that we grew up with. We have a classification of people that are quote unquote normal. But in this world, you're talking about several neurodivergence community. And I do agree with you on one thing. We all have mental health. It depends on what would trigger yours.
The gravity. Yeah.
Yeah.
Is the
If I lose my key and I can't find it, man, I think something is going to break down. Because if you're so sure that you left it in this particular spot and you can't find it and you're looking for it and you're the only one in the house. Anyway, my comment is more about the acceptance. There's so many, even in TV today, we're swimming in so many currents. You talked about Elon Musk and so many other people. I want us to also understand that these people that we have maybe categorized to be this or that, they have polarized functionality. The one extreme of it is bad, it's not acceptable. It's not socially acceptable to us or to most people.
correct.
The other extreme of them is that they're super intelligent. There are certain things that they do extremely well. When you look at even the gay and lesbian community, spiritually, I mean, I'm not stereotyping them, but when you look at intelligence wise, they're always in the forefront of this or that, extremely intelligent and doing this. So, in other words, we've got to find a balance. We need to inspect the narrative that we're believing in before we are accepting it. There are people that are core racist. There's no doubt about that. Just at the sight of you that you're a different color, they can't function. But there are people that, like you just explained, based on their developmental breakdown, they cannot comprehend all of these things. Most of them lack social cues. They don't understand. It says somebody died, they'll be smiling. It's not that they, it's not that they wish that person dead, but they can't comprehend the meaning of a loss at that particular time. to say that, oh, somebody died is not a good thing. They can't comprehend it. And I know a little bit about this because I work with this demographic. So I'm very excited that you were able to break it down. And where I'm going with all of this is that some of these things is kind of evolving and even more prevalent in our community. If you have a loved one, a child, or daughter, or sister, or a niece that is exhibiting this kind of breakdown, before you condemn them, because the sad part is a part of them will rationalize everything, they will justify it. You will see them as super intelligent. So when they do something that is out of character, it's difficult for us to give them a break. We are convinced that they know what they're doing, whereas most of them don't know what they're doing. I don't know how to, if I'm trying to differentiate that. They know what they're doing, but they cannot rationalize what they're doing at a certain time. So we need to help them to find help. We need to not just jump to conclusions about their inadequate conduct. We need to inspect a little bit more, and we have to figure out a way to maybe help them to get help or help them understand that, hey, you're experiencing a breakdown because, this breakdown is being stigmatized. Nobody really wants to be put in that bucket. Nobody wants to admit that they have a functional breakdown or mental breakdown. They don't want to. But when the children are young, you may find them in your churches, they may be in your mosque, they may be in any other area of your life. You might want to just suggest to them to have their kid checked up, or whatever it is, because especially those of us from Africa, it's a lot of yelling and trying to make people conform. This thing stresses them out even more, the yelling. Or it might even be bright light. Some of them cannot deal with bright light. It's like putting needles on their brain, when the light is too bright. So there are just so many things that we need to endeavor to understand more, more of this before you accept or deny that this is really what is going on. So thank you so much for bringing this. And thank you, Dr. O. Always, you always find that gem under the rock is another one. God bless.
Thank you so
Thank
much.
you,
Thank you. Much appreciated. Thank you. So, Sister Bumi, kindly unmute. Thank you.
Thank you. Thank you for having me here, Dr. O. I want to thank Dr. Elisha because this topic is needed. It's been needed for so many years. And then when you were explaining this, I just started remembering back when I was practicing in the retail sector, and I used to tell my
By the way,
workers.
pharmacist, she's a pharmacist. So think about that. The kinds of people who come in to the
Screaming
pharmacy.
at her, yelling at her, and
Yes,
rushing.
and I remember that I'm someone who you can yell all you want. I'll just be quiet.
Wow, good.
Because I
That's good.
believe it takes a lot for me to respond. If I respond, you know that I have really got to the wall and cannot crack through. However, I believe that if you have 10 people, you will find at least 9 that have some kind of mental issues. Different level of obviously there. And I remember, when I was in that sector, we see so many people. And I used to tell, a lot of my workers that you don't know, even at home, I tell my children, everybody, you don't know what is going on in someone's life.
Correct.
Everybody walks. You see people with their makeup, smiling like everything is great. But behind that
It's close to us.
is a whole lot going on. And all it takes is just something so simple for that person to snap. So I've had that experience before where this was in Boston. I was at the traffic light, and that was what changed me. I was at the traffic light. There was a car in front of me. The light turned green, and the car was still there. And I kept pressing my horn. The light turned red. He just got out of the car, came to me and started yelling. It was the scariest day of my life. That was when I said I will never in my life,
Yep.
No matter how much, because you don't know what's going on in people's mind or heart or at home. So I'm so glad you brought this up, because a lot of people are having these issues and we really don't associate it with, mental health. And it's not in our culture, even with diseases and things like that. So much is going on behind that all it takes is something small to trigger.
That's right.
Thank you so much. And the other day, what you were talking about a month ago, my husband and I were talking that, they should make everybody go for mental check.
Mental health screening, for real.
Everybody needs that.
Yep.
Everybody needs that. So thanks and kudos to you.
Thank you. You're welcome.
Thank
Thank
you
you for
very
sharing your
much.
experience with us.
Thank you. The experience you shared is scary and it is real. Road rage is a real thing, and things happen. We've read about a lot. Some of us on this platform have been exposed to that. That was what you were exposed to. That might have not gone as well as it did.
Correct.
He did not move until the light turned to red again, and then he got out of his car and came right at you yelling. That could have gone sour.
Sure. Yeah, sure.
I kept quiet and just looked straight. I didn't even respond, because you can, at that moment, they're in
You
a
could have had a
different space.
gun.
You can't even, if you look them in the face, that can be it for you. So
That's
I didn't.
right.
Another trigger. Yeah.
So
Thank God. So when we talk about neighborhood strife, you have this neighbor from God knows where. You really don't know what's going on.
Seriously.
Always racism, as you said. Thank you for that presentation. Honestly, this one is going to stay with us a long time.
And think about it too. Yeah, we don't know what's going on with them, but we can get sick too from their behavior. Does it make sense? As in, do you make sense?
Yeah.
You can be depressed. You can be depressed too. You can be anxious.
Yes.
You can be scared. Like, so many things can also come from that. So being self-aware is important.
Yes, absolutely. So iPhone, on Medical Mondays, we like names, so we can call you by name. Kindly unmute. Well, if you tell me your name, I'll help you post it. Kindly unmute. Thank you. You're muted. So go ahead. iPhone.
I see Madame Lara.
Yeah, I know. But before is the person on the top.
And she's not muted right now. The person is not muted.
Yeah, they are muted. Kindly go ahead, man.
Yeah, thank you for accommodating me. Just to buttress what Dr. Elisha said, that, some people exhibit some behavior, but they're not racist. I am moved to share this story. One of my ex-neighbor, she's Asian, and, she was just always very aggressive and all of those things. And of course, at the time, a long time ago, though, I concluded that, hey, this person does not like black people.
That's the first thing that comes to mind.
Yeah, but I saw her like probably 7 or 8 months ago, and her grandchildren, and they are black people. And I'm looking at her, I said, who are those people? She said, her grandchildren. I said, your grandchildren, how? She said, oh, yeah. My daughter married somebody from Ghana. This is as charcoal as they come. So, I mean, the thing is that maybe there was some kind of conviction along the way. Maybe she was what I thought she was at the time. But right now, right there and then, this is her current situation. She has to live with grandchildren of color. So like you said, I don't know if I was correct at the time, but if I wasn't correct, then, shame on me that I thought the worst of her at the time. And right now, this is her current life. So we never know. Thank you.
Thank you.
Wow. Wow. Thank you so much, man. Thanks for sharing that. Dr. Ogunleye, kindly unmute. Thank you.
Yes, I just wanted to piggyback on what our dear VP just said. Just because somebody has a Black friend or married a Black person or has a Black grandchild doesn't mean they're not racist. White people have their token Black friends. It's only that Black friend that they're nice towards. All other Black people are out. That one person is allowed in. So just wanted to say that.
That's deep.
Hmm. I will come back to everybody has a degree of mental health issues. And I say something all the time that if you see a doctor who does not have a touch of OCD, please don't go see that doctor because they'll kill you. You know, doctors are very particular, perfectionists, because your life is important to them and they want to save that life, even sometimes at the expense of theirs. So it's very important that we all pay attention to self first. When there is a squibble, something happens, I think it's important to stop, look at ourselves and see what part did I play there? Which one is my own responsibility? And when we are able to do that, we'll be able to, resolve things and mitigate things. It's very important.
Self-awareness.
It's the degree of mental health that cause, okay, the need for hospitalization and stuff like that. But many people go through life, never get diagnosed properly or
Right.
diagnosed at all or
Right.
taken care of, and they just live through life miserable.
Miserable.
So it's very important that we look into each other and please reach out if you need help, if you need just to be assessed to, to Dr. Elisha. She has,
Seriously.
that's what she
Free.
does. That's what she does. Reach out and just see, get evaluated, and make sure that all is well in your terrain. Auntie Tower, kindly unmute, ma'am.
Dr. O, I love your point. That is like self-reflection. Self-reflection. I'm going to shed more light on what she just said. Now, it may not even be the other person that we think is like harassing us, or there may be a piece of us that is contributing to that problem. So being aware of who we really are is also important to conflict resolution. Thank you for that point.
Thank you. Auntie Tower, you have the floor, ma. Welcome, ma.
Oh, yeah, I've been trying to to get in. I use another phone, and you said unmute. I did unmute, but I guess you guys can hear me. Good evening,
Ma'am, please go on,
everyone,
madam.
Good evening.
Good evening, ma.
and good job, Dr. Elisha.
Thank you so much.
Always on time online. Good job.
Thank you.
My question is like two separate form of questions. The first one is autism genetical? Can it be passed on?
Definitely, definitely. In fact, that's one of the top reasons for autism. Genetics plays a major role. If you see a kid in clinical setting, Dr. O can support my point or say something to this point. In clinical setting, when we see one child that is autistic in a family, we begin to suspect either of the parent with autism. one kid with autism will begin to suspect one of the parents. And if it's not a direct parent, somebody in the family had it. That's one of the number one thing that they were holding on to. Yeah, MRI showed its own thing. Neurochemical abnormality is there. Environmental factor is also there. They also think it's some kind of due to intrauterine, some kind of insult. We also think it's due to some kind of viruses. The top one among all the lists is genetics. Is definitely strong with autism, absolutely. And any disease or any psychopathology, yes, genetics is number one.
Well, another thing that we've discussed is about spiritual aspect of the autism. I know a friend that his son is autistic. He was born here. He grew up here. He acts weird. He screams all the time. Then they took him to Nigeria, to their church, and one lady said, you don't treat it with the parents. The father is a pharmacist, the mother is a nurse. This is not the way you treat them. There's another way I don't know what this lady did. This boy, he doesn't come back. He came after they have 2 children, but they went back to Nigeria. This boy calmed down. He got married to a teacher. They have 2 kids now. So what explanation is it? I know they said the woman they use church something. I don't know what they use because the father told me the details.
Okay. Unfortunately, I don't know what this marriage will look like right now, but I can tell you right now that autism doesn't go away. Okay. This kid, same kid that was autistic as a kid, is gonna be the same kid right now that is married and stable. But what I can say, I'm gonna compare ADHD with autism for a little bit. This kid, I'm not saying that spirituality didn't work out. Okay, whatever they did, I'm not gonna counteract that. But I can tell you right now that as they grow, and they do this social training and they support their skills, it tends to be minimal. Like it's not as bad as it. For example, if we have an autistic ADHD kid that is 3-year-old or 4-year-old, by the time that ADHD kid turn 8, 9, 10, 11, they look calm. I'm just saying. That is
Yes.
just the way it is. That is just the way it is. So I'm going to compare the same thing with autism right now. Maybe when the kid was little, it was worse. And slowly the brain grew and developed a little bit more, but it didn't take the autism away. I can bet everything in me based on research. I'm not going to bet my life on it. Okay. But I can say right now that autism is still there. That kid right now is married, is an autistic adult with a lot of communication issues in his marriage right now.
Okay. Then I have a neighbor that is a schizophrenic. And she went to school. She did everything. She got her master's. She got a PhD. She's a doctor. And she was a doctor because, but you could not function. It did not work one day in her life. Though, unfortunately, she passed away during the COVID. How do you explain that? She went to the regular college, did everything, but she could just not work in any environment.
Okay.
So
And
what's
this
the
was
explanation for that one?
okay. So now you mentioned schizophrenia. Schizophrenia is big. Schizophrenia falls under the DSM-5 criteria called psychosis. Now, under psychosis, we have schizophrenia. We have 6 types. We have schizophrenia, we have schizophreniform, we have schizoaffective disorder, bipolar type, schizoaffective disorder, depressive type, delusional disorder, and brief psychotic disorder. So my point. Now, with all those 6 types of psychosis, the main thing that connects all of them is hallucinations and delusions according to the DSM-5 criteria. However, the difference is just the time frame. If I'm having hallucinations and delusions right now, does that make me schizophrenia? No. I have to meet criteria, meaning, am I just schizophreniform, not up to schizophrenia, meaning I'm only going through it within 1 to 4 months, or within 1 to 6 months, or am I really full-blown schizophrenia and beyond 6 months I've been going through this? So I really wouldn't bank on that schizophrenia diagnosis. That person must have been misdiagnosed based on the hallucinations and delusions. I can tell you right now, even here in America, people that hear things and see things, yes, they will get married too and have a life, and they just cannot function on a job, but they can still have a career. Correct. So that will not be something that we cannot see. However, the diagnosis of schizophrenia, I can't really bank on that too well. That is a true diagnosis because schizophrenia is the worst of all. In fact, it is when they have schizophrenia, they are totally disconnected from reality. And I'm sorry for using this word. I'm very, very sorry. I'm not stereotyping them, but we call it weary in Africa. They're on the street.
Exactly.
They're on the street naked. So somebody that is totally disconnected can never get educated. So my conclusion right here, that person was misdiagnosed, but the person fall under some kind of psychosis.
Thank you very much. And thank you, Dr. O.
Thank you so much, ma'am. Yes, that is true. There are lots of misdiagnoses that go around, especially in our communities. They brand
So many.
somebody has that. It takes quite a bit for us in the medical profession to come up with diagnosis.
Diagnosed. Yep.
There are constellation of things that has to occur and certain numbers that occur before we say somebody has something.
Correct.
So, T, kindly unmute. I think, is that Dr. T? It just says T. Kindly.
Hello, Tina. Good evening. Good evening.
Thank you. You helped me out too.
Good evening. I just have a quick question. It was actually a follow-up question to the previous question, not this one, about racism. So in terms of probably categorizing racism, how do you categorize, like in Nigeria when you have tribes? And for example, I'm just going to use my own personal parents. You're like, okay, so this particular group of people, they are not, probably don't get educated, so you can't marry them. And it's not probably, I wouldn't say, and sometimes maybe not, it doesn't get to the point of hatred, but it's just a point of you can't associate. I'm just going to be straight up. You have Hausa, you have Igbo, you have Yoruba. It's, at least way back when I was in Nigeria, there was something about Hausas that they're not that educated. And so the worst, I mean, what a child can actually do to offend my own personal parents for you to actually cross and marry someone from a different tribe. So what would you call that? And literally, it gets to some point that it might actually look like they don't even want to associate with them at all, even being friends with them on campus or having it as neighbors. And so is that racism too? Is that, because I'm just trying to, because I remember vividly, that's the kind of thing that I grew up with back home in Nigeria. Just clarification.
Thank you so much for that beautiful question, Miss T. And I can tell you right now, I know the Bible says my people perish because of lack of knowledge. We lack it in Africa. Okay, the issue of class is a big deal. If you go to an event in Africa, you carry Toyota, you're in a Toyota, somebody with Lamborghini shows up, they may not let you into the gates, they will let the Lamborghini into the gates. That's exactly what your question is. It's so sad that we judge people by what they look like, by what they wear. In fact, recently I faced that too. I went to I'm not gonna say it, I went to an event and some people call me up and be like, why are you wearing that? You're supposed to rock everybody, you're supposed to dress past everybody. I'm like, wait a minute, I'm not the one celebrating, I'm not the one doing graduation. What is my own? I went there to see people. Why do I have to? What is wrong with my shirt and trouser? You know what I'm trying to say? I'm just a regular person. I'm just saying now, somebody like me in Africa, they will push us to the side because I don't like my gele touching the sky. Now, the what I'm trying to say there is your parents are not wrong, or whoever your people in your society are not wrong. We just need to stop that. We need to, it's got to start with somebody. We need to break that cycle. We need to say, okay, somebody that learned a mechanic is a person too. School is not meant for everybody. Hausa didn't born themselves into Hausa. They are people too. They have the same blood running through their veins. A Igbo person is a regular person. We can rent a house to them. We have to break that cycle. It has to start with somebody. So what will you call that is your question. I am going to call that one a major stereotype. I am going to call that one like a power struggle, a class situation. This is the person, this is a low class, this is a high class. You know, we don't have middle class in Africa. And middle class are people that are suffering. Okay, so it's either you are poor or you are on the top. If you're in the middle, you're just pretty much, I don't know. So it's so sad that that is there, but it's a mental thing. And I personally hate it. Really, I really hate it. When I go somewhere and I see some people getting treated better because of the way they dress or because of the way they because of the car that they drive, I call them to order. I make sure I say something to that effect. And I personally have experienced it myself. I will go to the store with my white coat. If I go to the same Aristita right here, I get so many hellos. Hello, hello, hello. Like seriously, I'm like, what? Then I go there one day with my flip-flop and a little short, maybe not short, maybe like a little, just not well dressed, like maybe t-shirts, maybe coming from the gym kind of outfit. You know what I mean? Nobody even say hello to me. I mean, that happens everywhere. It happens everywhere, and that one is just people thing. That one falls on that. It doesn't. It's not any. It's not in the. It's not even in the DSM. So it doesn't fall under racism. Racism has to do with race, color, your whatever. But I don't think it has to do with status so much. In Nigeria, it's about status. I don't think it has a
So
category.
much.
Yeah.
Thank you.
Thank you.
Thank you for that question. Excellent question. There's another
Beautiful one.
dimension to your question, the issue of tribalism. See, we hide on, we don't use that word racism in our African countries.
Mhm.
Tribalism, I'm sure you've heard, and it's the same thing. Your parents will tell you you are Yoruba, you cannot marry Igbo. It's not even about education now. It's
Mm,
just about the race. It's
the
about
race.
the tribe. You can't. So I have stood back actually several times and thought about when people, especially our people, talk about racism here. But what about us? Tribalism is racism.
Correct.
I have experienced racism, tribalism in the Igbo community against me here in the United States. I can tell you a few examples that I won't bother to say, but I have. So it exists and it needs to stop.
It needs to stop, for real.
We are all brothers and sisters, especially we even come from the same country originally.
Mm-hmm.
Why should that be tribalism?
Yeah. Mhm.
Why should you favor somebody because they are Yoruba like you, and because they are Igbo, then you give them preference before the Igbo brother or sister? No. We need to have love and spread it. The issue is lack of love, period.
Is it lack of love or lack of knowledge? I'm not sure which one.
Well, both maybe. And you have said it. It starts now. I would say it starts from each one of us. We each have to make a change. We make a ripple where we are, and then that ripple ripples, and it continues to ripple. We should not go with the status quo. I call myself Wazobia. I don't care where you're from. I don't care if you're black, white, red, yellow, green, orange.
That's right. We're people.
We are people. And that's how we should relate. Thank you so much for that question. It was very important, very deep. Thank you.
Thank you.
Queen Esther, kindly unmute.
Esther, me?
Yes.
Or someone else? Oh, Queen Esther. Oh, okay. All right.
Queen Esther. Queen Esther raised
Oh, so there are two of us here, huh?
Yes.
See?
So, Queen
Good
Esther, my
sister.
second Queen Esther. If you have something to say too, right after Queen Esther, Ijem here, you can go.
Oh my goodness, I've thoroughly enjoyed, today's presentation. Thank you, Dr. Kehinde, I think, for a wonderful presentation. This is a subject that is very close to my heart. Somebody sent me something, apparently a reply to maybe a comment or a question that the person had asked in a support group, autism parenting support group or something. And the person sent that to me. I loved it, but I'm going to read it. It's a very, very short answer to whatever that question was. And I just want to know what your opinion is towards this reply. So the person replying to whoever asked that question said, I know you are antsy for him to be consistent, but if anything, I think it just makes his brain more beautiful. Neurodivergent minds are not set up for consistency or obedience. They are set up for creativity, ebbs and flows, unique problem solving, questioning everything, and making connections between things most people wouldn't see. Even if he possesses the ability, he won't necessarily display it just because we all want him to. And I personally love that. I know it can be difficult to wait because the progress we've already made is so rewarding and helping you feel more connected with your son. I can't say if I'd be as patient if it were my own child, but that's just some food for thought. So what do you guys think of this? Because it made my day, but I'm not a medical doctor. So what do y'all think?
I mean, it sounds positive to me.
It is positive. However, the person who wrote this said that if it is their son, they don't know if they will be patient. So there's some component of difficulty to get along or to tolerate or accept.
What a God.
Please
It
mute, please.
I really think more like empathy, like she was just being empathetic with the mother.
I think
Like,
so.
given this situation, I understand where you are. So puts the parent to know that, okay, at least somebody gets me. Because, you know, when you have an autistic child, it's like she said, it's multifactorial. But then certain parts of the brain do develop much faster and they're constantly going. And that's why some people will say, oh, maybe they're high functioning in this area or the other area, because some area are actually developing much faster than the other. But you cannot conform them to a certain way. You just allow them to grow. And this is a very good topic for most Nigerians, because I see a lot of a lot of mothers that do not want to accept that diagnosis of autism. But it makes a difference in this country when you get that diagnosis, because the services are there to improve it. That is why some kids, when they're autistic at the early age, you may not even know they were that autistic when they're older, because they got the services when they're younger. Not because the autism went away, but they had the adaptive behavior to be able to improve and be able to function normally within community. Thank you. Sorry, I kind of butted in, Dr. O. Sorry.
No problem. Thank you. Thank you for that input. I'm not sure, though, that if what was read to us had to do with autism, but you're right on point when you talked about autism, everything you said. I'm not sure if this comment was about that. It's about a personality that is strong, that knows what they're doing, but they may not communicate it the way you want it communicated. They may not conform as you want them to conform. That's what I got from the statement that was read. And, you know, while it's a strong personality is great, if you are the recipient, it may not be that that pleasurable. Because the writer actually says if it's their son, they probably will not be as patient. So, but for whatever it's worth, you know, we all are different in personalities, and that's what makes the world beautiful. If we look at our fingers, they are not equal. If they are equal, the hand will not work with the fingers, or our fingers will not be as efficient as they are. And that's what makes the world beautiful, that we're so different. And so we can now synergize. Anyways, thank you so much, Dr. O, for your intervention. Dr. Adiola Pupola, kindly unmute.
Thank you very much, Dr. O. Thank you, ma'am, for the beautiful presentation. number one, when we're talking about stereotyping of our ethnic groups, what came to my mind is that, well, we may still need to want to see a Yoruba to be Yoruba, and Hausa to be Hausa, and Igbo to be Igbo, and every other group to actually have their idiosyncrasies. But is it possible we have in the context of this social relationship and what we've been discussing, to have a red line that one goes, that takes one beyond ordinary, just distinguishing between one another? What should be the kind of factor that have to be put in place? Is it when you discriminate to the extent that the person loses his privileges and rights, or to the extent that you actually completely fail to recognize the problems and challenges of the person? And I'm saying that from this point of view. You mentioned education. When the Boko Haram people started, uh, as far as I know, Boko Haram meant education is not, this education is not useful to us. That was what they said. That they wanted a discourse, but the whole thing turned into something differently, and it became armed struggle. And that was also one of the reasons why to be so unmindful of what the other person needs, okay, and decided that everybody should come down to rest to the same mid position. It's not helpful. They used to have nomadic education. We took it away and wanted them to have the education of the South. And they said this education is not useful to us. And we saw the parallel effect. So I'm asking from that perspective, is there some way of thought that even though we can keep our identity, ethnic identity, for so many social reasons, at the same time, the one that fosters unity and behavior in society, to at least to have some guidelines that one should not cross over? That is the way I look at it. Now, the second one, you were discussing about children. Yorubas will say that when it's another person's child, okay, you tend to say he is running mad. But when it's your own, you just say it's just misbehavior. And that summarizes it sometimes, that people tend to, because you've been living with the person every day, so you know the extent of the harm to himself and to others. Whereas any other person that sees the patient or sees the person, sees him as something very, very out of the way, dangerous and intolerable. So I think that when we see from that context, but I'm more interested in the first one, the way our guardrails we can use to make sure that a social relationship is well guided. There's nothing wrong in being any of the races or ethnic groups, but when it comes to relationship, there must be something we can use to at least guide society a little bit, from medical point of view, from social point of view, and from policy point of view. Thank you.
Yeah, thank you so much for the amazing question. Sounds to me like you're looking for, you're thinking about a solution, a way forward to preventing this, tribalism, especially from, going down the same path. And you particularly referenced Nigeria when you asked the question. I think based on what we've discussed, and I'm gonna piggyback on that, and I'm gonna add some more points. And again, the first thing is gonna be, mental health advocacy groups, education reform, media representation. I don't know if we even have anti-discrimination laws in Nigeria. Maybe if we do, maybe we should go ahead and, touch it up a little bit and make it known a little bit more. Also, maybe community dialogues like we're doing right now. We don't have town hall meeting, but this is looking like, hey, it's Medical Mondays, creating more awareness, educating people about it. And of course, some kind of religious leadership training, because Our religious leaders in that part of the world, for sure, they do have a lot of voice. They have a powerful voice. And the more they push this comment out there and create and teach more unity and shared history and talk more about diversity and so forth, hopefully this can close that gap. I mean, that's kind of what I have to say. That is what I can think of as a solution. It's not going to be overnight, but it can start now. Thank you.
Fantastic. Thank you so much. Thank you. That is important. We need to write that down, take note of it, and take it to where the leaders are to see if those can be implemented. Dr. Guleye, yeah, kindly unmute while she's unmuting. I don't know if we have anti-racial laws or anti-discrimination,
Anti-discrimination.
tribal. I don't know if we have anything like that in Nigeria. It's something that would be good to look into. Fantastic. You have the floor.
All right, ma'am. I heard a comment earlier on about having people in Nigeria, a lot of people who have mental issues in Nigeria walking the streets naked. And I just have to say this. When I was growing up, and by the way, I'm one of those kids that doesn't hang out with her peers. I'm one of those kids that will sit in a corner and just observe and read and sit at the feet of elders and, just have a conversation, learn. Even till this day, most of my friends are 10, 20 years older than me. So I learned a lot from elders. When I was growing up in Nigeria, I noticed that broken bones were treated locally by local orthopedic practitioners. They will set that bone, and within a short time, that person will be walking around doing whatever they're doing. They'll get back to their normal life. And they use local materials and herbs that they grind together and apply on the person and set the bone, and voila, the person will get better. I also noticed that people with mental disorders were also treated. In fact, I grew up in Kano. In Kano, when somebody has a mental disorder, they say iskoki, meaning the wind, that the person is dealing with iskokai. Even in Yoruba land, they'll say ofesi. And fe has to do with ategun, meaning wind as well. So they have herbs that they use for these people and take care of them, and they get better. But with colonization, a lot of those practices have been left behind. They have been forgotten because a lot of people see those practitioners as evil, as, I don't know, just bad spirits. So because of that, a lot of people shy away from learning those skills. And that's why you see a lot more people on the streets in Nigeria today. And besides that, look at the condition of Nigeria. Look at the economic situation, the insecurity and everything. Not only in Nigeria, and a lot of third world countries. Who would not go crazy in such an environment? Seriously, who wouldn't? I was in Nigeria for 2 weeks. I couldn't wait to get back, So I think there's something to be said for our local practice. Oh, cupping. They also did cupping. I saw cupping growing up. The thing that we thought Asians are the ones bringing now, cupping, acupuncture, and all of that. They practiced all of that in Nigeria back then when I was growing up. And to us, it's not good enough until a lighter skinned person, a white person, an Asian starts practicing it. Then we start funkifying it. Then it's cool. But when Africans are the ones doing it, it's backwards. I just wanted to throw that in. Thank you.
Much. Thank you. What I'd like to see is our older folks who have these recipes to have them share. Dr. Gulaye, they don't share. They keep it secret. And that's why they are not anymore. Colonialism did brought it brought medicine as we know it now into our culture. But they did not say that the interventions that our forefathers were having should be stopped. They didn't share. Even now, I've had situations where some people claim they have a cure for something. Okay, let's do research. Let's take it to the powers that matter. Let's do it how it should be done to research this. They give some of the products and leave one out. How do you deal with that? So that has to change. It's a shame that these things are being lost. I don't want to think that they have completely gone. I want to believe that we still have some people who have this knowledge that can pen them so that they can be continued. Look at Dr. Mike Oye, Papa Mike Oye. He comes on Medical Mondays, and not only Medical Mondays platform, it comes on Medical Mondays with Dr. O. It goes to other platforms to share knowledge, deep knowledge of the naturopathic stuff he knows and that he uses that works, and also taught us 5 weeks of farming to farm our own organic stuff in our yard, even in our living rooms, how we can do that in big farms. I wish all the others who have these gems will share them, or at least send them.
Dr. O,
Yes.
This person you're talking about that is sharing now wouldn't have done it 30 years ago. In Europe, in America.
Papa Michael, yeah, you know him. You've been on Medical Mondays, you know Papa Michael.
Yeah. In Europe, even in America, there were burning women that had this knowledge at the stake. They were quartering them and calling them witches. In Nigeria, they call them witch doctor. Every time they attach that word witch to a person, it's seen as evil, right? And a lot of these people had to go in hiding because they don't want to be seen as that. It's not that they don't want to share. Back then, before colonization, they were sharing. They had pupils, they had students, they had guilds, So it was colonization that stopped them in their tracks. But now that the younger ones are beginning to embrace their culture back, that's why you see a lot more people coming out and sharing and talking about it and researching.
I hope we see more of that.
Amen.
So we do research and, be able to utilize these skills in our communities at large, not only back home, but even here, Thank you. Thank you for sharing.
Ma'am.
Madam VP, kindly unmute, ma.
Thank you so much. Dr. O.
Yes, ma'am.
You mentioned that they weren't sharing. We, as African, we have a trust issue, and we subscribe to the Western world because of the transparency. You at least know what you're getting. When they give you a bottle of pill, they tell you what it's going to do. They tell you the downside. They tell you when to take it, how much of it to take, how much of it not to take. We operated back then based on it, just say, trust me. And if whatever you take dogoyaro tree, I don't know what it's called in English or biological name for it. It did what it was supposed to do. But our mentality is, oh, if this kind of thing can cure fever, I better take a lot of it. I remember growing up, I would bathe with it. They would give me a cup of it, morning, night. And we found out now that it was damaging the liver because excess of everything is bad. So right now, with awareness and with global information, we're going almost half circle back to these herbs, and they're calling it plant-based. That's it. We're going back to the root of this plant. We're going back to understanding what they are. And God bless Daddy Mike, who is sharing some of this knowledge with us, and as many of them. So I don't know how much of the pills are clinically developed, but my understanding is a vast majority of them are also from herbs, from plant sources that they modified, because some of this thing tastes nasty. They modified and put in a pill form. And even some of them, they're now putting them in liquid form. We grew up with what is called agbo. All you had to do is go to the market. Somebody who's completely uneducated, but vastly intelligent, you just say, oh, mama, I have rashes in my back. They'll give you 10 different stick or whatever, cook it, drink it for 3 days. You have no idea what those things are called. Neither can they even tell you what it is. They just know what they know. So right now, it's about striking the balance. Yes, we wish we could call all of them back from the grave if there's a way to recall them and say, give me what you got. But we're here right now that we need to start promoting as best as possible the plant-based, the herb-based, and all this local stuff that we know, But it has to be clear. We have to have guidelines of how to use it, when to use it, and what is it used for. That's it. Tylenol, for example, they tell you, hey, if you take too much of it, it will damage your liver. If you do, it will cure the headache, but it's going to give you 10 other disease or 10 other problem. So you take these things at your own risk. And that's what we've done. Not knowing what helped you, you just knew that some herbs help you. It's unfortunately dangerous because people also used those herbs or those agbo or whatever it's called. They use it negatively. They use it to destroy people, And here it's happening in America too. You have a dentist that was putting something in the smoothie of his wife, slowly poisoning her, knowing that this pill is poisonous. So it's about just striking a balance. We can't go from one end of the pendulum to the other. We are here right now. Let's change the narrative. Thank you.
Madam VP, I know you don't believe, but trust me, those elders are coming back. Watch the little ones that are born today. Just listen to them.
Okay. Resurrection. I believe in resurrection. Thank you.
Thank you so much. Thank you. You were on point. Thank you. You touched on research. One thing I want to add is, side effects, interactions. We didn't know any of those with those traditional things. And now today, those are the things we want to know. But if these people who have these formulas can share them, then the opportunity will arise to research them, to know what they do, how they do it, what dose will be appropriate, what they may interact with, side effects and stuff like that, to make them more, to make them much better
and user-friendly
than they were before and make them safer to use. Yes. Thank you. Thank you so much. So Dr. Duyebo wrote in the chat box, a medical practitioner that indulges in hand washing might not be diagnosed by him with OCD. The behavior could simply be due to training. If, on the other hand, the doctor engages in hand washing persistently, even without touching anything, he would ask how long this behavior has been observed to start considering a diagnosis. Thank you so much for that comment. I made the comment about if you have a doctor who does not have a touch of OCD, then don't see that doctor because they'll kill you. And I mean it. I would say maybe 100% of doctors have a touch of OCD, and I explained what I meant. They're particular, they're about your life. They would do anything and everything to perfection the best they can to save life and to give the best. It's OCD. You know, they want to make sure that that dose of medication is the right one and it is used the way it should be used and all of that. So that was what I meant. But thank you for your comment. Vince said, I think lack of love is a problem. We have been commanded as children of God to love one another as God loves us. Also, we are supposed to treat others the way we want to be treated, no matter what. But ignorance has taken over as self-awareness. No empathy for each other. Thank you so much. Excellent comment. Love. Dr. Elisha, I said love. But you added that it should be love and what did you say it was? You added something that it should be. I think the foundation, like Mr. Vince said, is the foundation is love, to love one another. It's very critical. Klembami Kole said he would appreciate some clarification. Isn't there a dimension of racism that is inherent in slavery and segregation? And Dr. Elisha, you responded to that. Kindly respond to that.
Oh, okay. So I just said yes, racism is inherently embedded in the history and structures of slavery and segregation, and that legacy can be understood not only socially, but also through the lens of psychopathology. Let's think about those people that were oppressed. Let's even start with those ones. Can you imagine the trauma, the PTSD? Can you imagine the anxiety that comes from segregation? Can you imagine this kind of loneliness that comes from that? So that is mental health on its own. And even those leaders that are oppressing people, if we look down to their roots, some of them may be psychopaths. You know what I mean? They may be, it's not about their race. It's not about race. It is who they are at the time. And socially, some people just embrace that. And don't think about it as well, that it was business too back in the days, if we have to talk about history. So some people were selling them from the other end before they can get them. They were not really throwing them on the ship. Some people were trading with them. It was a big business for some people over there too. So on both ends, okay, both the buyer and the seller, they must have some mental illness, period. And the people that they were oppressing too, they will develop mental illness in the process if they survived.
Some were stolen because we know records when
It
they
wasn't
went.
all traded. It wasn't all traded.
No, not all of them were sold. Some were stolen. Like they would be running in the forest and they run after them, catch them.
You mean
Like
kidnapped? You mean they were kidnapped?
kidnapped. Thank you.
Kidnapped in the process, right?
Anyway, so yeah, it
So we
was
see mental health from all angles there.
yeah.
So
So and Dr. Elisha wrote, we are not enemies because we are different tribes. We are enemies because we choose not to understand each other. And she wrote, adapted from Nigerian peace dialogues. And that is the truth. We need to change that. We need to take the time to understand each other and love each other where we are. And, he repeated, I think Dr. Elisha said love and knowledge. Yes, you're right. She said love and knowledge. That's true. Knowledge is power. That's part of why we're here tonight, to acquire more knowledge. Men, this has been deep, charged. So I'm going to charge every one of us. If anyone has a neighbor that is cantankerous and calling police every day, making life difficult, don't let them get to you. Don't let them give you anxiety or depression and give you mental health issues. Instead, sympathize with them. Create boundaries. They don't want you to come to their yard. Make sure you don't. Create the boundary that won't trigger them. Stay away from the triggers. And maintain peace the best you can. Because indeed, they may have mental health issues that need to be resolved. and you will not be the one to help them resolve it because already you're in their bad books for being their neighbor. It's not about racism. You are already an enemy because you're the neighbor, but you can pray for them, for the Lord to bring to them somebody who will be able to assist them to face where they are and to be able to connect them to care.
Dr. O, I'm sorry to interject. You're right about you trigger them by being in their neighborhood. The minute you move into that neighborhood, they come and visit you and they want to know, what do you do?
Yeah.
They're cute. Yeah, they want to know because they feel like you don't belong here. What do you do? So they're in your Kool-Aid. They're not your friends. So keep a distance.
Keep a distance. Keep it real.
Avoid triggers.
Yes, avoid what would trigger them. And you know, geez, Klembami Kole is on the roll tonight, said, then is it fair to say that hatred, not love, is mental health induced? Very possible. Very possible. Sometimes hatred is people hate because of jealousy. Jealousy is mental health issue. when you're jealous of somebody for what they have. If you want it, get close to them, ask them how they got there, and see how you two can achieve.
And to add to that,
Yeah.
and I'm sorry for bringing this piece in, but have you seen a parent hate her son, or have you seen a parent hate a daughter because they are mentally ill, but the parent can connect with it? For example, alcoholism is mental illness. No parent will like that.
Yeah.
And you will see a parent throw their own kid out because of that. I won't call that hate, but it's not a pleasant treatment, right? At the same time, it's hard on them, it's hard as well on the alcoholic or people that are bipolar. Their chaos, their manic phase, some parents cannot handle it. And because of the way it made them feel, because of the chaos they throw their life into, they start developing hate for the child, that you're making my life miserable. I hate to call it hate, but that's what it is. I've had to educate a lot of parents on this, that you're going to have to find peace with yourself. Your child's brain is fractured.
You don't think it's naivete, Dr. Elijah?
Naivety with bipolar? What do you mean? What is naivety?
That the parents don't understand it. It's a different terrain for them. They don't know what.
That's what I'm saying now. They don't know. They don't understand what bipolar is.
It's true.
So I personally educate parents. You know, we have family members too that we have to educate. And I'm like, you know what? Just count the blessings, count the good ones, and just move on from the bad ones and just keep praying. But don't blame yourself and don't blame them because, you know, they cannot help it too. They don't want to be that way, period. I truly believe that. They don't want to be that way. I tend to empathize a lot more for those, and it looks like I'm making excuses for them when I speak. But when I know somebody is going through some kind of psychopathology, I tend to I do my best to empathize and I make excuses and say, you know what, this is what they're going through. I understand, but hey, I'm human too. So sometimes you feel it too and just shake it off. You just shake it off a little bit faster, but you feel it too, though. It's not pleasant on your body too because you're only human too. But you don't go down completely like, oh my gosh, I refuse to accept it. Well, whether you accept it or not, they cannot help it. They cannot help certain things. The best you can do for them is empathize with them and show them how they can seek help.
So there's a comment here again from Klembami Kole. Some will even ask, are you renting or you own the house you are moving in? More or less sizing you up. We have experienced this. This is very interesting. We started our neighborhood 25 years ago, and we're still there. We started this neighborhood. It's a unique one formed by a Jewish man, Mr. Rouse. Anyways, we have a neighbor who just moved in, I think, a year ago or so, and he saw my son and my niece coming out of the house and stopped them to ask if they belonged here. What are they doing here in the neighborhood? And I don't know what those ones say. I think they just shrugged it off and laughed. They didn't say anything, but they told me. So I didn't say anything. And about a week later, I saw the neighbor standing in front of his house. So I went over, introduced myself, let him know that we started this neighborhood 25 years ago. And I told him who I was and told him if they need anything, knock on my door. Because we who started the neighborhood were like that. A lot of people have moved out, new ones are moving in because children are grown. We came because of the school system. But I let him know that you want anything. He stood there and just stared. And every time I see them, I greet them. So I agree with what you said. Yes, they will size you up, but you love them regardless. And that's what we need to do. We are responsible for how we respond. Are we going to act or react? And I encourage us to act instead of reacting. Dr. Ephraim says, thanks, Dr. O and Dr. Elisha, that what he got from today is no matter what comes your way, guard your joy and protect your peace. They are gifts from God that the world didn't give, and the world can't take it away.
That's beautiful.
Thank you so much for sharing that. And he wrote further, God is in control. Your joy is your strength, and your peace is your anchor. Stay steady, stay joyful, stay peaceful. Thank you so much. Dr. Veronica says, hot topic, so much learning. Thanks, Dr. Elisha. Thanks, Dr. O. We appreciate you so much. Thank you, Dr. V. We appreciate you too. And thank you, Klembami Kole. Geez, I learned a lot from you tonight. Also, thank you. He says, thank you for this illuminating discussion. You are loved. Thank you. Madam VP, kindly unmute.
Thank you, ma'am. I'm thinking that at the end of the day, we have to exercise tolerance for each other. Some people will pull out a gun and shoot you because your car is not moving fast enough. They don't even know what color you are. You're just in front of them. You're not moving fast enough. So we grew up from a community or an environment, and there are also environmental triggers. We grew up from a community where we are so nano intolerant. Yoruba, let me make example of Yoruba people. Those from Lagos, they tolerate Abeokuta and Ijebu. After then, everybody is Haraoke because we speak. We speak
No,
different.
all of them are Moroccan burgers.
Oh, really? And then people in the north, we call them Mola. And people in the east, Ajokuta Mamomi. And they have names for us too, you know. So at the end of the day, and the Bendelites, God forbid you call them Igbo, they will fight you. The what is Dr. Veronica's village? Dr. V, what is the name of your village? They will tell you that they're not Igbo.
Iseluku in Delta State.
Delta, yeah, the Delta people will say, God forbid. I mean, passionately so. So here too, those things are there. So I think we are in a unique position now to get understanding, to get knowledge, and be able to make a difference. At the end of the day, we need to be the light. I agree with Dr. Ephraim. We need to be the light. We need to be part of the solution, not building up on top. And that's exactly why the Black people in America had to fight to say Black life matters too. It does matter because, when you've been in a position where you are marginalized, when you're discounted, it gets to a point where you have to fight back. But at the end of the day, we're talking about diagnosis today. Anybody's zip code can change. You don't know what tomorrow is. If you hurt your leg and you go to DMV, they're going to give you a disabled placard. Right there and then, your category has shifted. So yeah.
From able to disabled.
From able to disabled, yeah. Right there and then, your category has moved. So, I mean, at the end of the day, the more we are learning, especially even if we're an extension of knowledge to the people in Nigeria, we need to start to educate our minds. We need to start to encourage one another to empathize with each other. We need to start to find solutions. We need to be patient with each other. And Pastor Ephraim said, accept where you are. Accepting where you are doesn't mean you don't find solution, you don't get help. But at least awareness, self-awareness, okay, so I have this challenges, I have this inadequacy. I don't want to be in this position. How do I get better? So, and may the Lord help us. May Dr. Elisha help us. Dr. O help us. And Dr. Bankole, all the doctors have OCD. Stop fighting that. So that is settled tonight. Whether you wash your hand 10 times or 52 times, we have already
We've concluded.
Everybody has mental illness.
So,
Because there's a degree. But seriously, I love what you said though. Seriously, she was talking about status that anybody's life can change at any time. Honestly, I like that because I say that all the time. I tell my student, I say, hey, you lose your mind, you lose your life. Don't lose it. It only takes a chemical imbalance. That's it. That is the fine line between you being well and you being sick. In fact, I always create like 3 cups of neurotransmitter, psychopathology, and psychopharm. I say a little switch or a little shift between those chemicals, a little drop in your dopamine can make you, a little increase in your dopamine can turn you to schizophrenia. A little drop in your serotonin can make you depressed. A little increase in your norepi can give you anxiety, and so on and so forth. So those neurotransmitters, anything can tweak it, a situation or any kind of imbalance, anything can or any kind of trauma, any kind of sorting experience or life shock, life situation can just throw you right there. So I say, you know what, don't lose it. At the same time, let's treat people well because they are human like us. They were like us. They were not, many were not born that way. It was some situation that led to that. And some were born that way, but many were not. It was life situation. So we can't afford to lose it. So she's so right about that. You know, anybody can be in an institution at any time. But I can tell you right now, it's a difficult place to be when someone have psychopathology or not, and you're right in your house, like my experience, and your neighbor is asking you because of your whatever, and asking, what do you do? What do you do? And for 4 years, I've been home, okay? And aren't you a nurse? Aren't you a nurse? Somebody asking me that, my neighbor. And as God will have it, I just said, yes, I am a nurse. And that was all it was a close-ended answer. And she continued to ask, she continued to ask, she continued to wonder, what the heck does she do? She didn't know I own a business and I work from home until I finally just, had it. I just had it with her. Like, and then I had to pull myself back, because I had to look at her history and things and how she was acting. I came up with my differentials and I was able to call myself to order before things gets worse than it was going, because it was going bad, bad, bad. And I was beginning to run away from her. Every time I see her, I run. I'm like, hey, I'm going crazy here a little bit too. I need to watch it. It affects you that way. You start to feel intimidated. You see her, your heart
Anxiety.
skipped. Yeah, your
Yeah.
heart skipped. Anxiety.
Yeah.
When your heart skipped, you start to have anxiety. Oh my gosh. And then I show up in the bucket and then she show up too. And I'm like, what in the world, man? I gotta fight, And of course, eventually I stood up and fight. Sometimes you must fight, but make sure you fight right. And pray for God to help you fight right too. But most importantly, pray to God to have your back because you can't fight too much in this country. You're gonna end up in handcuffs and that's it with your career. So I just had to like slow down a little bit on that and let God have his way. But it was beginning to look dirty and I couldn't believe that's racism really felt that I don't want to call it racism. Mistreatment really felt that way because it felt really bad. And I later looked deeper into it. And that was what got me started with the research. Then I started to think, oh wow, this is looking like autism. This is looking like autism. Then I picked more interest on autism. So I'm not saying she is, but she was, yeah, looking like it. But anyway.
Probably has more than that. Well,
Yeah.
I have a question here. How can a parent help an adult child that's addicted to sweet and now obese, but wasn't like that growing up? That question can be answered, but it actually does not line with what we're discussing tonight. Addiction is a big thing. And people can be addicted to anything. I was talking to my students today and shared with them that there are people that can be addicted to exercise. And they were like, what? Yes, I have seen it and had to help this person overcome their addiction to exercise. People can be addicted to food, can be addicted to anything. When we talk about addiction, people usually think of cocaine, heroin, crack, alcohol, marijuana and stuff like that. No, addiction goes beyond that. So this is a deep subject. This is a subject we have to talk about. That is a topic on its own. Talking about the addiction and even lifestyle changes for that weight loss to occur. It is deep. But since you have asked, you've thrown me a challenge. We would have a talk on that. That's a promise. So Dr. Clem Vamikole said again, it thinks there's nothing wrong in celebrating our identity and tribes, but we should do that by also celebrating our diversities. 100%. We are wonderfully and marvelously made by God. 100%. And Dr. Fola Adelui said, wow, this is loaded. Thanks for putting all of this together. Thank you so much. Thank you for being here. Thank you. So, Dr. Elisha, without much ado, I'm going to hand over to you to give us your closing remarks.
All right, I actually posted my closing remarks just in case of time and if I had to step away or something, but I want to say quickly that in every corner of our neighborhoods, there are voices unheard, struggles unseen, and needs unmet. Neighborhood strife, whether through poverty, whether isolation, through stigma, or lack of access, can deeply impact mental health and, of course, delay the recognition of conditions like autism, especially in adults who have spent years masking their pain or misdiagnosed with something else. So let us remember that mental health doesn't exist in a vacuum. It is, in fact, shaped by the communities we live in, the care we receive, and the compassion that we extend. Now, by fostering awareness, improving access, and of course, advocating for those who have long, gone unnoticed, we can transform strife into support and silence into understanding. It starts with us. It is in our neighborhoods. Let's commit to building communities where no mind is overlooked and no person, autistic or otherwise, is left behind. Thank you.
Wow. Thank you. Thank you so much for this robust conversation, a topic that people don't want to touch because, whoa, you're talking about your neighbors, but we needed to. Thank you. We have all learned, and I pray that we have grown a little bit more from this discussion tonight and would imbibe living together in love and understanding. Thank you. Till we meet again next week, please stay safe.
Thanks for having me.
Thank you.